Hi, my name is Maureen O'Neill Davis. I'm here to talk to you today about Family Forward Advocacy Connecticut. Family Forward is a movement in Connecticut that is focused on child mental health care access, child welfare reform, and shining a light on the impact of early childhood trauma on children and the parents, the caregivers, the families who love them. My family was affected by early trauma in that we adopted our two nieces who had witnessed the violent domestic violence oriented murder of their mother. We took them in and adopted them. And as years went by, the trauma that had been they were exposed to when they were younger began to emerge with a pattern of behaviors, um, symptoms that were so bizarre and dangerous and destructive in our world, in our home. Um, and that really started around the age of 5. And we tried to get help for the one daughter that was the most profoundly affected. And we soon realized that the child serving systems in the state of Connecticut that are in place to help families access specialized, complex psychiatric care for a struggling child just aren't really there. Child welfare acts as a gatekeeper to get levels of high need care, and in the end, they turn those inquiries and requests into child protective cases, showing the parents as neglectful and abusive, or neglectful in that they cannot meet the specialized needs of the child in the home, and process those parents within the juvenile court system as, quote, bad parents. Some families can gain access to a voluntary services model, but in most cases, the services offered are inadequate. It's too narrow menu of options, and the highest need kids can't actually get high need care, and they wind up in therapeutic foster care as an alternative to that high need care treatment models that the family recognizes and outpatient providers are recommending that child access. It's a vicious cycle, and what it does is it destroys families. It destroys the most vulnerable families because you work really hard, you research, you ask questions, you, as a parent, you are trying to follow the recommendations of the outpatient providers that you have gotten to and are involved with at that point, and they tell you to contact DCF because that is how you will be able to do an admission for an outpatient, intensive outpatient services, or how you will be able to actually gain access to residential psychiatric treatment. But in reality, it doesn't work that way. And we're going to talk about the reasons why it doesn't work that way, what families experience. We're going to talk to attorneys, clinicians, child welfare workers. We're going to talk to folks within school systems, and we're going to start to pull back the layers of the onion as to why families cannot actually access any of the treatment that kids with complex developmental trauma specifically desperately need in order to function in society, in order to become emotionally stable, behaviorally safe, and ultimately gain a level of empathy for others and an ability to form relationships with others. And that's what this channel is going to be about. So we welcome you to find us and to learn more about the conversations we're going to have in the coming future. We are Family Forward Advocacy Connecticut. We are based in Connecticut, but we are part of a national network called Family Forward Foundation, which can also be found on Facebook at Family Forward Project. That would be our national Facebook page. Connecticut residents, you can find us at Family Forward Project Connecticut or Family Forward Advocacy Connecticut. And we're going to be collecting stories from you, our new viewers, as to your experiences with child welfare, juvenile justice, school systems, in an effort using these systems to try to gain access to that higher level care, specialized needs care, complex psychiatric care that your kids need, not just adopted children or children who have experienced significant early trauma, but a variety of specialized needs kids. So we look forward to having you join us in the future. Thank you very much.